Mental Health Awareness Month is commemorated in May every year. Speaking at the official event, the Minister of Health and Social Services said they are revising mental health treatment to align them to human rights and global standards that will be finalized this financial year. Dr. Esperance Luvindao emphasized that the ministry is planning to visit Zimbabwe next month for benchmarking.
I wish to highlight there very importantly, I believe I mentioned about the mental health facilities and that these must be adjacent. We want to pause here and just very quickly acknowledge, and this must be explicit, to acknowledge the work that has been done by the colleagues, understanding very well that it is a high pressure environment and understanding that oftentimes the necessary resources have not quite been provided to the necessary staff. We take note of that. We also are well aware of the facilities that are currently present and available. And when I look at the numbers that we mentioned about inpatient and outpatient, these numbers and the number of the facilities we have do not go hand in hand at all.
Furthermore, she called for the implementation and monitoring of policy so that mental health services are accessible, equitable, and is of high standard across all regions.
But I think it is just to highlight that people that have, some sort of illness or whatever the case may be are not in any way, subject to less of humanity and humane conditions. And this is important to highlight. So whether somebody has schizophrenia, whether they have bipolar disorder, whether they have, a personality disorder, MDD, a delusional disorder, you name it, it is not an excuse for us to just, push them into a corner, in facilities where you yourself would not be willing to stay. If it is a facility where you yourself would not be comfortable in staying, then we have work to do. If it is a facility where you would not be comfortable leaving your child there overnight, then we have work to do. And it is important that we begin to address all our public health facilities in that very manner.
Mental Health Month was identified with the aim to raise public awareness about mental health and wellness, to reduce the stigma associated with mental illnesses, and to encourage people affected to seek help and support.